And there we are. That should now work. We all have the right names. Okay, so and people are just coming into the session. So welcome to everyone who is joining us on our third case study this morning. I'm delighted to introduce to you Aisling Shandley, who's the Deputy Head, and Margaret Ramsay, who's the PT Wellbeing at St Moden's High School in Central Scotland. And they're going to be sharing with us another SHINE case study, talking very much about how the health and wellbeing data has been used to inform a whole school approach to health and wellbeing. So very much about involving the wider school community. So I know you are both really busy people, so we're delighted to have you here with us today. And so I'm going to hand over to Margaret first, who's going to start the case study. Thank you, Margaret.
It's actually Aisling's going to start off. Okay, Aisling, you're on mute at the moment. Thank you, John.
Okay. Can you hear me now, Margaret?
Yes, I can hear you now.
Oh, good. Good morning, everyone. Thank you for choosing to opt into our presentation. As Dawn said in the introduction, our aim today is to share with you basically how we use the data from the SHINE evaluation that we did earlier in 2018, and how we try to involve our approach to wellbeing, and how we try to involve the wider school community in that. So I suppose a caveat before we start, we were very early on in the process, so it was a learning curve for us, and we did learn lots. So we will take you through what we did at that time. And to understand how we use the data, we thought it was important that you understand a wee bit about our school. First of all, we are St Moden's. We're a Roman Catholic high school in central Scotland. We're quite unique in the sense that we cater for young people from right across Stirlingshire, Clackmannanshire and Falkirk, or West Falkirk. It's a huge geographical spread, and some of our children travel as much as 20 miles a day just to get to school. So that can have in itself a number of barriers for us to with parental engagement and getting our parents into school. So that was one of the things we wanted to overcome with our work. We're currently on about 1,020 pupils, and we have an integrated pupil support system where we have a horizontal system of PTs, pupil support in every year group, a PTASN and inclusion, and a PT of autism, because she runs the only Stirling Council secondary autism provision. So within all of that, we decided we still had a gap, and in that gap we wanted a PT wellbeing. So a few years ago we used some of our PEF money, which Margaret will talk about later, to introduce the role that she's currently doing. I think it's important to understand that all of our work, all of our wellbeing work, is very much related to our school values, our Catholicity, and our nurturing and welcoming and caring ethos through our whole school. So that's really what we focused our wellbeing work on. So in doing that, we realised, as I said, that we needed somebody just like Margaret, and I'm going to hand over to Margaret now and let her talk a wee bit about the role that she does.
Okay, thanks, Aisling. I've been in this role for 2 years. I've been at St Moden's for 3 years, and this is the first line of my job spec. And I was very excited about it because for me, mental health, our well-being affects everyone, and everyone needs to be involved in it. And this SHINE report came just at the right time for me. I was just coming into the role, and I was handed this by Aisling and our head teacher at the time. And you'll see that it was just a small group of S2 pupils who were involved, and it was half male and female. And this is our key findings. You'll see that it was a lot about kind of emotional health, about feeling left out, this lack of confidence, which we did a little bit more kind of digging with it and found out that that was affecting poor self-image, particularly within the girls. But also in the study, there was help about different organisations that we could contact, and you'll see that we used that in the wellbeing fair. But also the family community involvement, and that's something we really want to be working with families on mental health. And it was so important that we shared this data. And you'll see that we did kind of 4 tiers. It's vital that you do have senior management behind you on this. And We also, you'll see in red, this is how we went along to groups. And apart from the focus groups, everything was done in the diary. All these things were set up in the diary. We're busy people. I teach home economics full time, and we wanted to naturally go out and get people's opinions and get this wide range of views on this data and think, can we use it? How can we use it? And so we have pupil advocates, mental health pupil advocates, and we have a school improvement group for staff focusing on wellbeing. And we came up with this aim, and again, you'll see the keyword is positive. We want to look at the positive but body image and how this can give us positive mental health and good well-being. But again, we want to make sure that we're working with the whole school. Okay, we want to have this whole school improvement cycle. So the Shine report fitted in with what we were focusing on, particularly over that year and over the next couple of years. And we then decided that we would come up with this whole kind of school wellbeing week. And you'll see the programme here. And our theme was body image, and we looked at hashtag no filters, and we really focused on that. And I'm just going to briefly look at how we involved. We had to make sure that pupils and staff were involved, this whole school approach, and then we could reach out to our wider community, which was one of our key goals in this. And we went for this big kind of introduction so that we could build on this foundation and go back to that dripping tap effect. So we made sure that we got staff involved. We did have our school improvement group, but it was quite small at that time. And we used collegiate time. It was a bit like speed dating. All the school improvement groups were in the hall, and we had 5 minutes with each, groups of staff. And that is where we got some of our key ideas for this whole week, and also, to go further with, and using staff skills. And that really worked. Staff are behind you. Then we're able to kind of keep going and keep working with it. And then involving pupils, right? We had our advocates, they had to take ownership of this. And you'll see that we really involve subject skills as well. We had this cafe during the week, and we had business, we had hospitality together. They could literally probably run Costa now. But that again helped this whole image, the confidence in being able to run this. And we had a very successful week, and I know we've got a few minutes left, so Aislinn's going to talk about particularly how we brought in the wider school community. Okay, thanks, Aisling.
Thanks, Margaret. I think that's key. Some of the pictures, the photos you'll see on the screen at the moment were about some of the lunchtime activities, because we were focusing on the key findings about pupils lacking that self-confidence, the poor self-image, and feeling left out. So we wanted to make sure that what we focused on was about including everybody and making them activities that everybody could become involved in. So you'll see the Instagram for the photographs with the no filters idea was lunchtime. We also did a dance flash mob at lunchtime with staff and pupils, which went down really well. And one of our music teachers did a sing-along in the atrium with the ukulele club. So it was very much activities that anybody could become involved in and could be part of the community, and building that sense of self-esteem. Then, as we wanted to take that a wee bit further into the learning for the week, but like all schools, we're very focused on learning and teaching, so we needed the health and wellbeing activities to complement that. So for 2nd through to 6th year, we did it as part of our health and wellbeing, our PSHE lessons and our RE lessons. But for 1st year, we did specific workshops as well. So we worked with a number of partners, and as Margaret said, we looked to the Shine report basically to give us advice and help on some of the partners that we brought in. We looked at the recommendations that they were making, and Margaret and the other school improvement group members who ran the week talked specifically to the presenters who were coming in and spoke specifically about the Shine findings and what we were looking for, what we were hoping to achieve from the week, and how we wanted to use that information effectively to build on something and to create a whole school and a wider community response. So that was one of the key things, looking at how we ran those workshops and how we ran the fair. Every class had an opportunity to come down and to visit the fair, in the sense of there was also a treasure hunt that they had to ask questions, again specifically related to our target outcomes. They went around and they asked different presenters different questions and found out different pieces of information, and it was seen as kind of again an informative but a fun activity for them to do. And as I said at the beginning, one of our hardest parts of trying to bring people in and expand this to our whole wider community is actually bringing our parents in, giving our geographical setup. We have a very active PTP, parent-teacher partnership, and they support things, but it was bringing more parents in. So we did what all schools do. We had the kids do something, so the kids brought their parents. So there was options, there were dance performances, so the parents came in as a result of that. Some of the music staff ran singing workshops with the parents and the child, so you do that together. And we had a connection with the National Parent Forum, and through that they did work with parents on social media and about the pressures of social media and the impact on mental health, you know, specifically around, again, body image and self-confidence. And I suppose that idea of involving parents very much in it, so they were active when we brought them into school in that afternoon. So I think what's probably left to say from us is the sense of how we used the data and what we've learned, because as I said to you, this was our first kind of you know, exposure to this kind of information, and how we used it was really important, how we wanted to make the most of that. So we learned a lot, but I think more than anything we recognized the power of using the information and using the data, and how it really gave us a sense of focus for what we wanted to do. It also, we've worked a lot with the pupil advocates about that information and about how you use data and how you move forward from it, and how it leads on to the next steps. We very actively promoted the Teen COVID Life Survey, which I know we're hearing about later in the conference. We were very active in our promotion of that, and we had over 300 responses. So we really feel like we've got a very strong place now to start from. We've already started the analysis of the results that have come in for that with the mental health advocates as well as the school improvement group, to kind of plan and inform our next decisions and how we move forward. And we have plans to now share that with parents as well as we move forward. So I suppose using the Shine data has empowered us really to respond with concrete data to a need that we thought we had, or we thought we had identified, but the data gave us that information to be able to do that. We planned our learning around that. And I think we certainly benefited from having the expertise that being a Shine school allowed us to have that, that proper analysis done, and gave us the pointers and gave us the guidance. So I suppose it's been certainly a learning curve for us, and we know we're going to go forward and use the data more in the coming months, and over the course of this year, the mental health interventions are planned based around the information we have from the Teen COVID survey. So thank you, Shine, for that. Thank you.
And thank you too very much for presenting this morning. It's a fantastic case study with a great demonstration of the application of the data. So the data is the starting point, but really what you did with the data, bringing in the school community, starting those conversations, speaking to the pupils, involving the parents, and getting the ideas from the staff is exactly how we would like to see it work, that it's a partnership of all those different elements coming together. So great presentation. Thank you very much for that. So we're now open for questions. If anyone would like to type in the box, in the Q&A box, and ask any questions. Although we may not have any questions because it was such a clear presentation. You've been so thorough.
I've just had a wee message from someone I used to teach with, so that's nice.
So we're bringing people together through the network. Yeah. So any questions at all on using the data? Oops. There we go. And so were there any barriers? I'll ask you a question. Were there any barriers to using the data that you came across? Were there any difficulties in sharing with particular groups? Was it easier to share with some groups than others, maybe?
I think it was quite a small number that we were dealing with, first of all, and it was just an S2 at that point. But I felt that because we had some information, we were, I think people were very open to taking that on and trying to develop it more. And I think people were very keen to just look at mental health generally and be involved.
Yeah, perfect. Okay, well, we have no questions in the box, and I think that is actually testament to your fantastic presentation that gave such a clear demonstration of how the data was used, and a great sense of the context, and some lovely photos in there of the pupils sort of enjoying themselves and how those interventions were working. So without further ado, I'm going to close down this session. We'll move into the lunch break just now, which will run until, I'll just turn my page, which will run until 1 o'clock. So we have an hour for lunch just now, and then we'll be back with our next 2 case studies. So thank you very much again, and we will. So here's another personal message just before we go to Margaret from a former colleague from Peter Haviland. So Margaret, you're a superstar. Everyone knows you.
Thank you.
There we go. Okay, so I'm going to close the session down now, and we'll go for lunch. We'll be back at 1 o'clock. Thank you again. Great session.
Thank you.